If you're over 50 and you take a little pill every morning for your blood pressure, amlodipine, losartan, or lisinopril, I need 60 seconds of your time before you swallow today's dose. Because right now, millions of people are sitting in their doctor's office, pointing at their swollen ankles, their constant dry cough, their brain fog, their sudden taste changes, and being told the same four words. That's just aging. I'm Dr. Jennifer H., and I've spent years watching patients get handed that explanation like it's a final verdict. No further questions, no further tests, just aging. Here's the problem. Aging doesn't happen on a schedule that perfectly matches the day you started a new prescription. If your ankles ballooned 3 weeks after you started amlodipine, that's not your body getting older. That's your body trying to tell you something specific. And it deserves a specific answer, not a shrug. These three medications, amlodipine, losartan, and lisinopril, are some of the most prescribed drugs on earth. They save lives. I'm not here to scare you off your blood pressure medication. Stopping these drugs abruptly can be dangerous, and I will say that more than once in this video. But there is a wide, well-documented gap between this medication is necessary and every symptom you feel while taking it is unrelated to it. That gap is where patients get lost. That gap is where real treatable side effects get filed under "you're just getting older" and stay there for years. So today, I'm walking you through 6 side effects that are quietly, commonly dismissed, backed by what's actually written in the clinical literature, not internet rumors. Some of these you'll recognize instantly. One of them, in particular, catches almost everyone off guard because it doesn't show up where you'd expect it. Stay with me to the end, because the 6th one is the one most people have never even heard connected to their blood pressure pill, and it's the one I get asked about the most once people finally make the link. Let's get into it. Side effect number 1, the ankle swelling nobody questions. Let's start with amlodipine, because this one is almost a cliche in cardiology offices, and yet it still gets missed constantly. Picture this. A 68-year-old man named Robert tells his doctor his shoes feel tighter by evening. His doctor measures his ankles, nods, and says, "That happens as we get older. Your circulation just isn't what it used to be." Except Robert started amlodipine 4 months earlier. Amlodipine is a calcium channel blocker. It relaxes the blood vessels, but it relaxes the small arteries more than it relaxes the veins. That mismatch causes fluid to pool, especially in the lowest points of your body, your ankles and feet. This is called peripheral edema, and it's one of the most well-established dose-dependent side effects of this entire drug class. It isn't rare. It isn't subtle once you know to look for it. And it is absolutely not the same thing as ordinary age-related swelling, which tends to be more symmetric, slower to develop, and not tied to a medication start date. The catchy way I explain it to patients: if your ankles suddenly look like they're wearing socks you didn't put on, check your pill bottle before you check your birth certificate. Side effect number 2, the cough that won't quit now. Let's talk about lisinopril, an ACE inhibitor, and the side effect that sends more people to urgent care, allergists, and pulmonologists than almost any other. The dry, scratchy, "I've had this cough for 8 months and nobody can explain it" cough. This happens in a meaningful percentage of people on ACE inhibitors like lisinopril. The mechanism is fascinating. These drugs block an enzyme that also happens to break down a substance called bradykinin in your lungs. When bradykinin builds up, it irritates the airways and triggers a persistent, tickly cough that doesn't respond to cough drops, doesn't come with a cold, and doesn't go away on its own. I call this the phantom cough because patients chase it everywhere except the one place it's coming from, their medicine cabinet. They get chest x-rays. They get allergy panels. Meanwhile, the fix can be as simple as switching to a different class of blood pressure medication under a doctor's supervision. If you've had an unexplained cough since starting lisinopril, that is not a coincidence you should ignore. Side effect number 3, the gum changes nobody connects to their pills. Here's one almost nobody expects: amlodipine and gum overgrowth, medically called gingival hyperplasia. Patients come in saying their gums look puffier, their dentist mentions it during a cleaning, and everyone assumes it's just poor brushing habits or what happens to your mouth as you age. But calcium channel blockers like amlodipine are a documented cause of this exact change in gum tissue. The catchy version I tell patients: if your dentist suddenly starts asking what medications you're on before they even look in your mouth, that's not small talk. That's pattern recognition. This isn't dangerous on its own, but it's a visible clue that your body is responding to the drug in ways worth discussing with your doctor, especially alongside other symptoms. Side effect number 4, the potassium problem, hiding in your blood work. This one is quieter because you can't feel it directly, but it shows up in your labs and it gets explained away constantly. Both Losartan and Lisinopril affect a hormone system that controls how your kidneys handle potassium. The result in some patients is a gradual rise in blood potassium levels, called hyperkalemia. Mild fatigue, occasional muscle weakness, or a vague off feeling can come with this. And it's incredibly easy to write off as low energy from aging, poor sleep, or stress. But high potassium isn't a side note. In more significant cases, it can affect your heart's electrical rhythm. This is exactly why your doctor should be checking your potassium and kidney function periodically while you're on these medications, not as a formality, but because this side effect is real, measurable, and manageable when caught early. The catchy line here: your blood work doesn't get tired and blame old age. If your potassium is climbing, your body is sending a very specific, very legible message. Side effect number 5, the dizziness that gets blamed on everything else. You stand up from the couch. The room tilts for a second. You grab the wall. Your family says that happens when you get up too fast at your age. All 3 of these medications, amlodipine, losartan, and lisinopril, can cause a drop in blood pressure that's most noticeable when you change positions, known as orthostatic hypotension. It's most common shortly after starting a medication or after a dose increase, and it's a leading, well-documented cause of falls in older adults. This matters enormously because falls aren't a minor inconvenience. They're one of the most serious preventable risks for older adults. Treating that dizziness as an inevitable part of getting older, instead of a measurable blood pressure response, means missing a chance to adjust the dose or the timing and prevent an injury before it happens. Catchy way to remember it: if the room spins every time you stand, that's not your age catching up with you. That's your blood pressure dropping faster than your legs can adjust. Side effect number 6, the one almost nobody connects: taste changes and appetite shifts. Here's the one I promised you, the one that surprises almost every patient I explain it to. Lisinopril and ACE inhibitors in general can alter your sense of taste, a side effect called dysgeusia. Food starts tasting metallic, bland, or just wrong. Patients describe losing interest in meals they used to love. And because this tends to develop slowly, it gets folded into the broad, vague bucket of your taste buds just aren't what they used to be, or appetite naturally drops as you age. But unexplained persistent taste changes that line up with starting or adjusting a medication are worth a direct conversation with your doctor, partly because the side effect itself is fixable, and partly because unexplained appetite loss in older adults should never be waved away without a real explanation, since it can affect nutrition, weight, and overall health if it continues unaddressed. The catchy version: if your favorite meal suddenly tastes like nothing, don't blame your taste buds for retiring early. Ask what changed in your routine first. So here's what I want you to walk away with: ankle swelling, a cough that won't quit. Gum changes your dentist notices before you do. Rising potassium hiding in routine labs. Dizziness when you stand. And a sense of taste that quietly fades. None of these are guaranteed to happen to you. Most people take amlodipine, losartan, or lisinopril for years with no major issues, and these medications remain some of the most effective, well-studied tools we have for protecting your heart, your brain, and your kidneys from the long-term damage of high blood pressure. I am not telling you to fear your prescription. I am telling you to question the easy explanation when something genuinely changes after you start it. It's just aging is sometimes true, but it is not a diagnosis, and it should never be the end of the conversation. It should be the beginning of one between you and your doctor, with your full symptom list on the table and your medication list right next to it. Here is your action step. Before your next appointment, write down exactly when each symptom started and line that timeline up against when you started or changed your medication. Bring that piece of paper with you. That single piece of paper turns a vague complaint into a pattern your doctor can actually act on. And to be absolutely clear, because this matters more than anything else in this video, never stop or adjust amlodipine, losartan, or lisinopril on your own. Abruptly stopping blood pressure medication can cause a dangerous spike in your blood pressure. The goal here isn't to self-treat, it's to walk into your next appointment informed enough to ask the right questions and get real answers instead of a shrug. You know your body better than a 5-minute appointment ever will. Trust that. Advocate for it. And if this video helped connect a few dots for you, share it with someone you know who's on one of these medications, because the next person who needs to hear that's not just aging might be sitting right next to you. I'm Dr. Jennifer H. Take care of yourselves and take your questions seriously.